And along with Pauline, I'm a pre-dental. I'm actually just graduated from USC with my master's in health administration and medical gerontology. So I'm a non-traditional student, and Pauline will introduce herself.
Hi everyone, we're so happy you guys are all here. And thank you for the USC students who are here to present. I'm a fourth year at UCLA. I'm a pre-dental student. I'm going to be taking one gap year and then hopefully starting dental school. And I'm applying in this cycle, and I've taken the DAT. So if I can be of any help for any of you, please contact me or Osneep. I'm sure we could both help. You guys can begin, whatever you guys.
Okay, well, we made a little presentation, so if you guys want, we can just start with that. It's like a intro to who we are.
Really quickly, I think Armen can't hear, so he's gonna leave and come back.
Okay. Oh, I missed that.
Also, and just a reminder for all the attendees, if you guys have any questions, make sure to throw them in the chat. Raise your hand, or if you don't feel comfortable with either, then you can private message anybody that's a host right now.
All right, my thing's working now.
Cool, because you're up first. Wait. Okay, go.
Do you have control over this, or do I?
No, I have control, but I think I
Okay,
know
well.
when to switch it.
All right, I'll just let you know when to move on. Okay. So that's my name up there. My name's Armen. I went to CSUN for undergrad. I transferred from GCC, but I didn't decide to put that in the bio because it's not that important. But I finished my BA in bio at CSUN in 2017. I applied my first time to dental school. I didn't get in, so I'm a reapplicant. So if you're one of those people, don't lose hope, because I was one of them and I still made it. In the meantime, I did my master's at USC for global medicine. Finished that in 2019. And during my second semester of the program, I got accepted to dental school. So I matriculated right after, and I started dental school in 2019, and I'll be done in 2023 with Mariam and Talar. Next slide, please. So pretty much at CSUN, I did a lot more volunteering and shadowing there for sure. I did a lot of like non-dental stuff at the USC Verdugo Hills Hospital. That's my local hospital. Just so happened that USC was the owner of the hospital. In terms of shadowing, that's for sure dental related. I did it at an oral surgeon's office. I did have experience at a general. So whenever you apply, pretty much schools like to say you should get a lot of experience in general versus doing a specialty. And so I had both, but I just put down the oral surgeon's office that I shadowed at. So at CSUN, I did do research. A lot of schools will say, oh, we like people who do research. Some say it doesn't matter. Some, I don't know, but I had the opportunity to do research, so I did. If you're interested, and I think it's still available, I'm not 100% sure, but I did Bio 495D with Dr. Oppenheimer. And our research was pretty much for E-cell testing the clumping and unclumping. It's been a while. And as you can see, you get an award, you get a little medal through your participation from the research, and then you partner with class and you actually do grading for, I believe it was a 6th grade science fair. It might have changed, but that was what was available at the time. For extracurriculars, I didn't really do much, but while I was at CSUN, I was part of ASA. And as you can see at the bottom, that's me and my friend Alec, and I volunteered for the Armenian American Gala at Beverly Hills. And that's Ken Davidian, who plays Azamat in Borat. So I had the opportunity to take a picture with him. So that's a highly treasured photo. So I decided to put that in there. In addition, that was whenever I was the social chair, and the middle picture is all of us that were on the executive board. And I was a member first before you become a exec board member. So I believe that's still the case. Mariam, next slide, please. So pretty much, like I said, I didn't get in my first round, so I did a master's. I did it at Keck, and it's called Global Medicine. If you guys are interested, there's pretty much four like divisions that they offer. It's clinical, which is, from my experience, it was like everyone that was pre-med was doing clinical. Then there was management, interprofessional, and the fourth one, like I keep forgetting, but so I did management. That's pretty much you like choose your own science classes and you get to take a few business courses to really get a full scope of what the program offers. They require, I believe, a minimum 3.0 if you want to get in, and you need a standardized exam. So anything like a GRE, MCAT, DAT, I think you need a minimum of like a 17 or something like that. But you should check on their website and talk to them if you're interested. Through here was more of like a grind of like keeping the high GPA because that's the point of a master's. So I volunteered a little bit less, but I was more USC related volunteering, if that makes any sense. So it was more like I got to keep my GPA high, and if I have time on the side, I can volunteer. And I did volunteer, and that was through Delta Delta Sigma, which is the pre-dental organization at USC. Unfortunately, I don't have any pictures with them. It was pretty much like a more an educational thing than like a social thing. And these are the images of graduation for the Global Med program. Pretty much, actually, in the image on the right, three of us, except for the guy the guy in the left in the white shirt, we all are at USC right now. So pretty funny. But yeah, that program is a good feeder to USC Austro for sure. And if you have any questions, I can probably give you some advice or tips, or I don't remember that much about it, but I'll do my best. Next slide, please.
That's
Oh, perfect. It's Talad.
Okay, as Arman said, my name is Talad. I too went to CSUN, but actually I didn't know Arman. I never saw him, and it was weird. I was like, oh, we both like took the same classes, knew a lot of the same people, but we never really crossed paths. But anyways, I went to HBU Pasadena High School, and I went to CSUN right away for the full 4 years. And then I applied, I took the DAT. So my biggest mistake, I think, was that over the summer, I started taking genetics, which I'm horrible at. And I started studying for the DAT. And it was a lot. It was a lot. And I didn't do well. And I applied, but I still got interviewed. I got interviewed at Loma Linda and USC, but I didn't get in. So after that, pretty much I was like really, really heartbroken. So I was like, I didn't know what to do. So I did what everyone else should do, like something to like kind of, I don't know, like Armen, like shadowing. I hated doing stuff like shadowing, volunteering. I hate like just like kissing ass, for as they say. I hate doing that stuff. I can't do it. So but anyways, I started shadowing a general dentist, and then I'm sure all of you guys know Dr. Gary Kevorkian, an orthodontist. And then I also started volunteering as a ambassador at CSUN. If some of you are from CSUN, you guys know those people who walk backwards, who give tours to like random families who want to come to CSUN. So I did that. But yeah, so then I didn't get in, so I kind of had a gap here. And so then I found out about the USC dental hygiene program, which at that time, they actually just got rid of the program, but at that time it was called the DHDDS pathway program. And so basically you had to have, Miriam, you can go to the next slide. Basically at that time you have to have done all of your prereqs, so you can go to like a community college. This also applies to like other dental hygiene schools too. So basically you have to have all of your prereqs done for science, because you have no time to do it once you're there. It's you think it's just dental hygiene, but it's really, really hard. I can honestly say it's harder than dental school so far, but you learn a lot. You have to have a minimum of 3.0 GPA. Your DAT has to be done, I think, by February 2nd, at least for USC, it was like that. And yeah, and then you do also have to interview. So it's very, very similar to the DDS interview, but once you get in, you don't have to interview again for the DDS. So you get in for the dental hygiene part, and then basically you just like later on, if you have your certain scores for your DAT and for your GPA, they kind of just towards the end of the cycle email you saying congratulations, you got accepted, and then you don't interview. But some people in my class had gotten in as just regular dental hygiene students and they applied. They also had to have taken the DAT just like everybody else while managing all of their dental hygiene courses. And I believe 3 or 4 people from my class got in. And we gained a lot of experience, saw over 80 patients, learned how to hand scale, ultrasonic, all of these things that I'm saying now, like the dental students are learning now. Nitrous oxide, local anesthesia, I think they just had a course like last week. Whereas see now they are learning it, I already know it. So it's it helps to kind of get a refresher, but they actually have us teaching them sometimes. It's kind of weird. And then we also started volunteering for the Union Rescue Mission. We started working on homelesses, the retirement homes, like these like people who are basically on their way to like their last breath, and you're kind of trying to help them with their dental needs, whatever that may be. Mobile clinic, dental sealant plan, and then also we volunteered for the USC Great American Smokeout. It's kind of a day where you literally walk around USC and you tell people to like put their like e-cigs or whatever in a box and basically stop smoking. And we did oral cancer screenings that day. But yeah, so now the dental hygiene at USC, actually just like last week, we got a letter that it closed, but I think there are 3 people outside of USC dental hygiene in our class who have been accepted. And they also do not have to take a lot of the courses like the other dental students. And it has, I think, helps going through dental hygiene because you learn a lot. But yeah, that's pretty much it.
Okay, so I guess I'll go last. So my name is Miriam. I did my undergrad in microbiology and molecular genetics. If you guys are from UCLA, you know what it's MIMG. It's you hate yourself if you do that. I got my BS in 2018, and then I had a gap year and I went to Keck, but I'll talk about it a little bit more later. So I actually started from PCC. I graduated high school in Armenia and I came straight. I went to community college because I couldn't take the SATs over there. I transferred within the 2 years, and since I started community college, I was a pre-med. So I was the basic like pre-med turned pre-dental. And I was shadowing a neurosurgeon just because I would have the opportunity to see both the hospital and the dental clinic. And that's when I kind of realized I wanted to go into dentistry versus medicine. At UCLA, I was super active in almost everything. My biggest thing was I did research. If you're in the MIMG track, you probably know the 199 courses and the 109 A and B, where you actually get to do research. You publish it. You have a poster presentation at the end of every semester, and then you also get to TA and help out the class. So that's a really good experience to have under your belt. And then I was also in Dr. Martinez's lab. We're doing basically HIV, EBV research on statins. I don't know if his lab is still there because he was supposed to retire, but if you have the opportunity to get into research and if you want to know how to get into research, because I know it's horribly hard at UCLA, let me know. Like I can help you out. I can guide you a little. I volunteered at the transfer center. I was their mentor. I volunteered at Reagan. I joined ASA super fast because I started ASA at PCC and then I just kind of transitioned into UCLA. I was their internal vice president for 1 year. And then I was also in their dance group. So if you guys look at the middle photo, that's actually us. I think right after Coachella, and if you guys know what it is, it's a pretty fun event. And I was also involved in All ASA. So I started, when I transferred to UCLA, I was their secretary, and then I became their chair, and then I became their treasurer. So I've pretty much done everything ASA related while I was an undergrad. And then when I finally decided I wanted to go to dental school, that was after my first failed attempt of an MCAT. And I ended up with a gap year. So I was kind of confused. I didn't know what I wanted to do or to fill that gap year. So I last minute applied to Keck for their master's in public health. I chose the policy track. It basically is, they have two tracks. You can either do it online 1 year, it's fully online. You only have to do 500 hours of field work and you can choose where you want to do. You can do it at CHLA. You can, I actually learned that Austro Dental School has an office you can work at. So it's different projects, you do it and you're done. It has 4 tracks. It has biostats and epidemiology, global health, community health, and health services and policy, which is what I chose because I really like the policy and law aspect of health. And I finished that in 2019. You do need a GRE. I did take the GRE, so I don't know if they needed a DAT or an MCAT. I don't know if they accepted, but I'm pretty sure they do. And I was focused on that. I continued to shadow my dentist throughout the year. And I also had so much time. Actually, right before graduating in 2017, I did the Armenian eye care project, which I went to Armenia for 2 weeks. And we had this big mobile clinic. We'd drive around and we'd see a lot of like patients for optometry. We'd give them glasses, we'd give them exams, we'd like see kids. And we'd also worked at their optometry hospital and we got to see a lot of cool surgeries. And then in 2018, I had the 3 months off after graduation before I started grad school. And I did Birthright for, I want to say it was exactly 3 months. I worked at their hospital, their cardiology hospital. I shadowed their dentist. So it was a really cool experience overall. And it's a really fun thing to do because not only you work in the field you choose, but you also get to meet people from around the world. So after that, like I have friends in Moscow, I have friends in Europe and like everywhere. But yeah, I think that's pretty much it. So if you guys have questions, oh yeah, and also I just added these because this is our class. These are just all of the Armenians in our class. I think we're the biggest, right? I think we have the most people.
Yeah, and we're definitely the closest.
Yeah.
Facts.
Well, thank you for the intros. So to best streamline the process, if you have questions, please raise your hand or submit it in the chat and we'll call on you. And we also have your submitted questions and we'll read off them in between.
Just a quick disclaimer before we start. I think I speak for all of us when we say we're not admissions people, we're not guidance counselors, we're just dental students. So we're just giving you advice based off our own experience in the application cycle. So if you like what we say, if you don't like what we say, you're more than welcome to take it into consideration, but please actually go to your own admissions counselor, guidance counselor, dental school, whatever, and then like confirm or talk to them. So that way we're not held accountable and you know what you're doing as well. So feel free.
Yes, thank you. Tanvir, you want to go first?
Yeah, I just wanted to know if you guys know any like scholarships for pre-dental students, because I know it's like a pretty big loan for dental school, and I just want to like see if I can apply to any.
I know of, so Austro has a scholarship. Apparently they give it out and they hold like a gala or a banquet for it. The reason I don't know much about it is because obviously I didn't get it. Otherwise I'd know about it. But apparently other people in our class, maybe like 20 people, I want to say got it, but it ranges.
I can add on that actually. So when I was in dental hygiene, it was the same thing. So all that money would go for the hygiene students and the dental students. And it was $2 million they have every single year. That's how much money they have to give to the students. So they give, I guess, to 20 people in per class. And I think it's around like $10,000. That's how much I had gotten at the time. So, and that's once a year. And then also they also email us like all the time about like scholarship opportunities, all the time. But it's like 1,000 here, 1,000 there. It's not like as big as the one Armin was talking about.
Oh, okay. Can I do like a little follow-up after that one?
Of course.
If it's okay. So I don't know about this, but I've heard like you don't get financial aid from FAFSA. in grad school? Is it the same for dental school?
You mean like, okay, yeah, there is no financial aid. It's kind of when they say you get financial aid, it's like you get a loan, and then the rest you kind of have to do the, what is it? So we only get the subsidized and unsubsidized loans through FAFSA after you fill it out, and then you get the graduate plus loan. But there's no like, it's not like undergrad. You have to pay for it all.
Oh, okay. Right.
And
Thank you.
there's also I think dental professionals loan, which is a lower fixed APR if like you're interested in it. That's also, I don't have it, but I know a lot of people that do.
Yeah, most students usually do the dental professionals or the army-based ones.
Yeah.
Okay, Sona submitted a question. Have any of you heard of the Basic Dental Principle program at UCLA? If so, can you tell me more about it and if it's worth doing?
The UCLA person is Mariam, so.
And she shook her head.
I honestly have not. I know there is a very big pre-dental group at UCLA.
I think I know what program this is, guys.
Yeah,
It's not offered anymore. It's an outside source. I used to work there at the School of Dentistry. So
No,
it's
I'm
really
in-
expensive, and a lot of clubs right now are doing the same activities remotely. So I would say try to join pre-dental clubs. They're doing the same carving and everything. It's like $2,000, I think.
Oh yeah, it's not worth it. Because I remember when I was at UCLA, we actually did like sutures and we were invited to dental school for a lecture. So it's not worth extra.
But we do have Minelli and Tala who are in it. So sorry for saying that. We're keeping it real in this meeting.
I'm actually in it too right now.
And Polly.
I think you're mistaking with something else. But
I was talking about the official School of Dentistry one. But if it's
Yeah,
a
yeah,
club-based
yeah.
one, I'm wrong then.
yeah, it's not expensive. There's like a lecture section and a lab section that you have to do. I would recommend it. I think it's worth it. Like you learn a lot of like little things, and you have like dental students from UCLA kind of presenting, and then you kind of get their contact info, and they're really nice and really open to helping you. So you have like, well, I personally have built like kind of a mentorship with a few of them. So I think it definitely is worth it. And like it's nothing crazy. It's just now it's on Zoom, so it's just like a simple meeting like once every 2 weeks.
Okay, if we don't have anyone that's speaking up, I'm going to read off the list of questions we had submitted. So for the three of you, why USC?
Do you want me to start? Mariam, take it away.
You start.
Honestly, I chose it because the location is close to home. When you like whenever you read the forms, a lot of people would say go to the cheapest school, but then you also consider the fact that most of us live at home. So that's a huge chunk of money that I end up saving by not living on campus. That being said, USC is pretty close. I love the environment over there. I checked it out before. I kind of went to like other schools and like saw what the atmosphere was like, and it was pretty chill at USC. And a lot of people always told me, "Oh, it's a great program," and I got in. So I was like, you know what? All the factors just checked off for me, so I decided to go into USC.
I want to say it was similar to for me too. I loved USC's location. I honestly love, I know this is not professional, but I love the vibe of USC because they don't treat you like, when I went to the interview, I didn't feel like they were treating you as, oh, you're just a student. They're more open to, oh, we're all eventually going to be colleagues. So they start that very early on. Definitely the location, the networking opportunity, just because I know I want to stay in LA and I just want to connect with dentists and future dentists that are going to be in LA. So if I need referrals or I need patients to be referred to. And yeah, also doing my master's at USC just kind of helped. I fell in love with USC. I kind of like it more than UCLA now. Sorry. But yeah, the grad school was just different.
Even though you're wearing blue. But anyways.
I have to.
For me too, I think it was a lot of things like location. That's of course the crazy connection USC has. Also, USC is like known for their hand skills, for teaching their students hand skills. And so as a dentist, you have to be good with your hands versus, no offense to anybody, UCLA, they're more like good on like didactic courses. And yes, that's important, but I think in this case, as a dentist, you need to know what you're doing. And we are exposed literally the day of our white coat ceremony. We had assignments like drilling teeth on our first, before school started. We had to do and turn in and then go get ready in the bathroom for our white coat ceremony. So like they don't mess around. And also there is this like fine line of like being professional and friendly. Like the staff is very professional and teach you everything by the book and like are grade you very seriously, but then also they're like very friendly and like talk to you like they're your friends and are very welcoming. So I think it's a great environment to be in.
Okay, the next question is, how do you balance school and a social life?
It's kind of easy with COVID, to be honest, because everything's on Zoom. Before we like us Armenians, the D1s and now D2s, we were the social lives of each other. I mean, maybe you could go to the gym or maybe you could see your boyfriend or girlfriend, but that was it. Um, yeah, you don't really have much of a social life. You do have a little bit of free time. You have a lot of free time if you know how to time manage properly. Um, Other than that, I'd say there, yeah, especially with COVID, there's a lot of free time, and people start to get interested in like specialties, so they'll devote more of their time into, let's say, shadowing someone or doing extra stuff. While if you're, content with doing general, which a lot of people are, they just, just do what they have to do, and then they end up having more free time. So it really depends on you and how you can manage everything and what you're really interested in. But you have a little bit of free time for sure.
Yeah, and the way our schedule is made, if I remember correctly, pre-COVID, we had at least one weekday off. So it was always either Wednesday or Thursday. We'd always have that off. So if you want to use that to study or if you wanted to use that to socialize with your friends, that's completely fine. Because I don't think it wasn't that bad the first year. Second year was supposed to be horrible, but we're in COVID and I haven't been to school in, I want to say, a week now. So it's manageable.
Yeah, I think in the beginning, regarding like studying, I think we were fine. I think you'll be fine too. But we have like 1 week where we have midterms. That's kind of when the craziness begins. But regarding your like social life, it's so easy to have one. But you do get a lot of lab work, and that was when we would come in during the weekends. But you're with your friends, so it's like really fun at the same time. But yeah, so you'll have a social life, but also like to a certain extent, you have a lot of lab work to do, which is normal. But yeah, you guys will all be fine.
So Ronnie asked a question, but I'm going to combine it with another question because I don't know if it applies to you. Armin already answered. So would you guys say you did better on the DAT the second time around? Was remembering the material harder after a few years since doing your bachelor's? And to add to that, we also had submitted how did you study for the DAT? So I think it all goes together.
Yeah, so I took it more than once also. So I took it before I went to dental hygiene, didn't do so good. Second time I took, again, it was in the summer, took the entire 3 months, went to the library every single day, studied, and I can say it didn't matter that it was like way after I got my biology degree. It doesn't matter. I think the test questions are so like tricky and like you need to know the tricks to the test. It doesn't matter. So I did a lot better the second time. And yeah, I think maybe it might be better if you take it more than once, only because you get exposed to like sitting there for an hour taking a test and also like getting used to the type of questions they're going to ask you. What was the other question that they asked?
How did you study?
How did I study? Oh, okay. So at that time, I used Chad's videos. And then for the PAT, which was my hardest, but then I did a lot better, I used what is that guy online with that generates the boot camp? That one.
Ari?
Ari, yes, I did that. And I used the destroyer. That helped. I think the destroyer was spot on with it. It's really hard. I think it's a little bit harder, but definitely prepares you.
Did you work on everything at the same time, or did you like complete one and then went to another?
Can you
I'm
repeat?
having trouble hearing you.
Yeah.
I'm sorry, guys. I was just asking if you studied from all those materials at the same time, or you completed one and then transferred to the other one.
All of them at the same time. I kind of found this, like someone had created the schedule online to mix Chad's videos, DAT bootcamp, and the Destroyer all together. So I was studying all of them at the same time.
Do you guys have any flashcards or something that you have made and you don't need, you can share with us?
I have like the hard copy. I mean, pieces of it. I can give it to you, but
I'm surprised you kept it.
yeah, it's for
I
my
tossed
sister.
everything
my
after
sister.
final.
But yeah.
Thank you.
If no one has anything to add, Tala raised her hand if she could speak next.
Hi guys, thank you so much for doing this, by the way. I just have a quick question. So a couple of you mentioned you guys did some master's degrees, you did like DH to DDS. I graduated UCLA in June. I'm planning on applying this summer with like no master's like or anything. I guess my question is it like possible, you know, to get in your first time, no masters and whatnot if you have decent stats? What do you guys think? I know you're not like admissions and whatnot.
I want to say it's completely doable. Just make sure you tell them what you do during the gap year, like make it as like make the best of it. So make sure you get shadowing hours if you're in research at UCLA, if you can continue to do that. Just so when they look at you, they look at, okay, she actually did something during the gap year. Again, I only did the master's just because I applied and I got lucky to get in. But yeah, I'm pretty sure it's very doable. I think there's only like 5, maybe like 10 of us that have masters.
No, there's a lot more. Yeah.
But there are people who have gone in. Sorry, really quick. There are a lot of people who have gone in who don't have masters. So
Yeah, I think like 40 people out of our class of 144 have masters and 100 people don't. So you really don't need a master. Yeah, you really don't need a master's if your stats are pretty competitive. The whole point is to give you an upper edge to be more well-rounded. If you have a red flag or a weak point in your GPA, you need to fix it. A master's or post-bac, depending again on whatever your counselor, whoever recommends, should be the route that you take. But it's completely doable to just apply as is with normal DAT, normal GPA from undergrad and get in.
Thank you guys.
Okay, the next question is, how was the interview process for you guys? I know USC does it a little different than other dental schools.
More about the MMI.
So I don't know how it's gonna be, or will it be ever the same again with COVID, but pre-COVID, I can tell you exactly how it was. We had 4, I believe, MMI. Actually, no, correction, 2 MMI where it was pretty much like an ethical scenario. And you read a prompt and then you go in and you answer it. And then there was like more of why USC, tell me about yourself. The school's expensive. Why do you want to come here? Why should we accept you? Things like that. It's honestly just practicing and practicing and practicing. They want to make sure that you're well versed and not rehearsed. And that's pretty important because they can tell on the spot if you're just memorizing answers. So if you're like shy or nervous, it's cliche to say don't be, but everyone's nervous that day. So just try to make it flow and seem like you're talking to a friend. But the MMI wasn't too bad. It was comparable to, I've had a worse interview in ASDO in Arizona. That was bad. So this one was pretty easy. After that one, this one was pretty chill. For the PBL, I would look up how to do a PBL case. I can't really, like if I explain it, I'm giving it away and I'm probably gonna get into trouble, but it's pretty easy. You basically work in a group and you dissect the case and you come up with ideas. To just like see how you work in a group. That's pretty much it. And after that, you take a tour, you watch a few lectures, or they lecture you, and then that's it. It wasn't a bad day. It just took a while. It was, I think, from 8 a.m. to about 5. But now on Zoom, I have no idea.
My sister actually just interviewed and she just got accepted to USC. And her, I think MMIs was on the Sunday. I think it's mandatory. You can't change the date to that. And it's like recorded. It's like they give you the prompt and it's like ready, set, go. And you just record yourself on the screen. And then the next day, which was like Monday, she had like a Zoom PBL, all of that stuff. So that's how it was for her. I didn't have MMIs when I applied. So I don't know about that.
Okay, so this might be a little broad because I know you're not an admissions team member, but Sati asked, is there something specific we need to consider in our applications?
I want to say just
Yeah,
right.
I could just add.
Like I
Yeah,
said,
I would say every school is different.
yeah, just you gotta just write everything you tell them. It has to be like, don't BS it. Don't be like, oh, I want to be a dentist because blah blah blah. Like actually speak the truth, and I think it should be fine. But I know that the essay is probably one of the most important ones that they look at after the grades and the scores are filtered out.
I actually used to work at a dental school, and I'll say just be yourself. They could tell when you're faking it. They know when you're looking at forums. They always say after interviews, oh great, everyone gave the same scenario. They know when you're reading, just be yourself. Okay, so the next question was from Nadia. What aspects of your application do you believe were essential to your success?
I can take this one. I'll start. For me, I want to say it was probably my research, the letter of recommendation I got from that research lab, and the master's. So those 3 are probably the key things that got me in, because I don't remember my GPA, but I remember it wasn't that great. Like I didn't think I'd probably get in the first time.
So pretty much you fake it until you make it with actual stuff, if I could put it in nice words. So whatever you're proud of doing, something that was an accomplishment, if you can talk about it, if you can prove to them that this makes me unique, it's going to stand out. You're going to stand out and they're going to notice that for sure. So like a master's, not everyone has one, but it's a situational thing. So I kept talking to them about the masters. They were probably sick and tired of it, but I wasn't. So I'm like, I did this, I did that, I did this. So I go, oh, okay, okay. And then I talked about anything that I liked. It's basically conversational. So I steered it into what I like doing. And they kind of saw that, oh, okay, this is someone different versus I play the violin and I study at the library and that's it, So it's just whatever you're interested in. That's your opportunity to talk about it, to shine, and they'll definitely take notice. Because if you're unique and different, I think that's what they tend to prefer.
For me, I didn't do any of this research or any of that stuff. So for sure, it was my GPA. I had a pretty good GPA. My DAT scores the second time were pretty good also, and for sure my dental hygiene experience. I had a lot of experience and letters of rec from doctors that they know. So yeah.
So the next question in the chat from Lucina was, did you guys apply with a committee/composite letter?
No, I just got separate letters from, I believe I got one from genetics, one from research and embryology. I think one from OChem, maybe. I'm forgetting the third one. But no committee letter. I just want to give a quick shout out to Hike, who just joined the group chat. He's one of our classmates. He's not going to be speaking, but just a quick shout out for him.
Hike, it's not too late to join the panel. Just kidding. But yeah, you see, they're a big community of Armenians at that school. So the next question is, how was the transition from undergrad to grad for you? Do you feel you would have been well prepared for dental school without a master's?
So going from a lecture hall that has 350 students that don't know each other with a professor that doesn't know your name to a class of 140 pretty close-knit people, I want to say it was easier. again, I told you guys, my UCLA is super hard when it comes to socializing, and like I didn't have a good experience with my professors, so it was definitely a better transition, and it was just a closer community, so I liked it. Masters, again, mine was online, so I didn't even get to see a lot of my classmates. I saw them, I think, once during like a football game, but that was it.
For me, CSUN was pretty much the opposite of what UCLA was in terms of like being approachable with professors and smaller class sizes. But I had about like 17, 18 units a semester. So it was pretty comparable to what I end up taking at USC in terms of like the science. So it's just pretty much the same level of science, I guess. It's just the lab is really brutal in terms of time. So if you're worried about the didactic courses, you shouldn't really be concerned. It's more like you need to get with the page about lab and working with your hands and being proficient at it. But it's not too bad.
Yeah, so I also went to CSUN. So I think honestly, when I was at CSUN, I had a much harder time. It was pretty hard. The science courses we had to take, it was difficult. But I think this is bad to say, but I think dental school is kind of a breeze. And I don't want to say that just because of COVID edition or whatever for dental school, but really, I think the only I think for me that was difficult was the transition from like, you go to school, you have these PowerPoints and they're presented to you and you memorize them, you take the test, you do well. You come to USC, PBL, there is no PowerPoint. It's not like that at all. It's all PBL. So it's kind of like self-study. You learn topics and at your own pace, at your own time. And you learn in the beginning, you don't know what to study. For the first midterm I took, I was like, I literally don't know what I'm going to take right now. I don't know anything. And I went in and I was like, oh, okay, I understand how to study for it now. You just learn topics. There's no like set PowerPoint where you learn. So it was difficult at first, but you get used to it. It's a breeze. The hardest part is getting in.
Yeah, I kind of want to add on to that the easy part of at least for USC, is the fact that we don't have lectures. We only have lectures for the dental classes, but the didactic courses is all on your own time. So you're not stuck for like 6-7 hours looking at a PowerPoint and falling asleep.
So somebody actually asked, how is the PBL format of learning? Did you have trouble adjusting or have any tips for incoming students in regards to PBL learning?
For me, PBL learning was really hard in the beginning. I had it tough. I had it tough in the beginning. I told you, like I want to say a semester and a half, everyone was studying, and I'm just like, what are you studying? Like, there are no PowerPoints. Like, what are you learning? And people were reading book. I'm like, what book? Like, I don't even know what you guys are like. I had no clue. And then over time, it was kind of just like, this is kind of what happens in PBL. Everybody kind of fails and they kind of curve it, not fails, does really bad because they ask a lot of weird things and they kind of just curve it, and that's how it kind of, they kind of grade it. But now I know. So they kind of give us, like, let's say we're learning on cerebral edema. So for a person who got into a really big accident, so they give you topics. So now you have to know how to address a patient when they first have an injury. So it's like A, B, C, D, E's. These are the topics. They're not telling you specific things. You go research this on your own and you go learn it. So that's what they do now. But for someone who's used to PowerPoints, organized things like me, I had a hard time.
Yeah, honestly, for me too, it was still definitely challenging. I want to say up until now, sometimes I'm confused. I'm like, what exactly do I need to know about this? Because sometimes it's not a dental topic whatsoever. But you do get the hang of it, and depending on who your facilitator is, like I've had professors that would tell me exactly what I need to know, and then I've had people that are just kind of be like, here you go, you learn it all. Thankfully though, we do have, like, the upperclassmen always create like study guides or like list of topics and videos we should watch. So we do have some guidance. It's just it doesn't come from the school itself. It comes from upperclassmen who I want to believe did well, and that's why they created the study guides. But yeah, you get used to it. It's definitely better than sitting in front of a power and lecture for 6 hours though.
Okay, so our next question, I'm gonna make it optional if you want to answer it or if you want to just talk about brackets. We had a lot of people ask your stats and your DAT scores, but I know that's an uncomfortable topic to go over and it's optional because we're recording.
Yeah, I don't care. I'll talk about it.
Thank you.
I have no shame about it. I applied with I think I had like a three-ish. So pretty much, long story short, I screwed around at GCC and I took my GE courses. So whenever I transferred to CSUN, I didn't have any GEs to take. It was all my science courses. So my science GPA ended up being higher than my overall, if that makes any sense. But I applied with about a 3.3 my first time. I didn't get in with the masters. Bumped me up to about a 3.4, 3.5-ish, and I got a 20 on my DAT. And if you get a section that's kind of low, don't worry, I guess, if it's like one section, if it's maybe like an 18 or something, and if you got like average 20s, they don't worry about that. But yeah, so roughly 3.4, 3.5 into 20.
I honestly don't remember my GPA. I remember it was like below a 3.7, above a 3.4, somewhere in between. DAT, I got a 22. And then my master's was a little higher. My master's was a 3.8. So I think that just kind of averaged everything out together.
For me, for CSUN, I had like 3.85 for my GPA, and then something like that for dental hygiene. For what I remember for my DAT, I'll make you all feel better right now. The first time I took it, I had a 16 for sure. And then I had like 17s and 18s and maybe 119. That was the first time. Then I took it again and I had 117 in reading comprehension. The rest was like 19, 20, 21, 22. So big gap. Just how well you study, I guess.
Yeah, I got a 16 on PAT, by the way, and it was the worst section ever, and I still think it is. So if you get something comparable, don't be disheartened, because in my opinion, it's absolute bullshit. But they want it, so you're gonna have to do it, and you're gonna have to do well. But everything else for mine was ranging from 20 to 22, and just PAT was just all bad. But like if that was my red flag on my application, they definitely overlooked it because everything else was pretty well-rounded and solid. So yeah, so if you get a 16, don't worry.
Yeah, guys, people get in with 16s and 17s.
Yeah, I'm one of them. So
hold on, guys. So I think they're hinting at me. So whatever you guys get, I say apply, because I actually got in with an overall 17 on the DAT, and I had a GPA of like a 3.6. So no matter what you get, I say apply and just show up for your interview when you get it.
Shout out to Hike and shout out to Bears for joining too if you want to pitch in. We have their whole crew here. So the next question is, when should people be taking the DAT and when should they be applying?
I think traditionally, whenever you feel confident enough, if you've taken enough bio courses, I think the timeline is about junior year of undergrad. That way, if you do bad, you can retake it in senior year. But honestly, you can do it whenever you want. If you've studied well enough and if you're confident, just take it. But if you feel like you're unprepared and you can push back the date and I don't know, maybe take a physio course or something and you become better and you know the material better, then take it after the physiology, obviously. But it all depends on what classes you've taken, what you're taking, and how confident in your knowledge you are. So it really depends.
Yeah, honestly, there's no like exact timeline when you should do it. It's, as Armin said, whenever you're ready. In terms of applying, I applied, I want to say 2 weeks after the applications open, so like early July, late June. I got my interviews in September. It did take them longer for me to get the acceptance letter, so I didn't get it in December. But my roommate at UCLA didn't take the DAT until September when she was applying. She applied in, I want to say December, and she got in March. So it honestly just depends on your application and whenever you feel ready to do it.
Okay, another question is, what is some life advice before dental school?
Make as much money as you can, travel, spend it all on fun stuff because you're pretty much bogged down with school. You do have free time, but just enjoy yourself before dental school starts. Yeah.
And collect a lot of teeth as much as you can. You're gonna need it.
Life advice, not dental school advice.
This is life advice. We look for teeth all the time. But yeah, enjoy your life, honestly. You'll have a good life even when you're in dental school. We even have I don't know what she is. One of the higher up people. I don't know if she's VP or not. But basically her name is Dr. Navazesh, and she's always making sure that we don't have anxiety, always checks on us and makes sure that we're happy, our social lives are good, our health is good. You will be fine. I'm telling you, the only hard part is getting in and just enjoy it. But yeah, definitely travel.
Yeah, I'm gonna just add on to that. Travel, have fun. Most importantly, start dental school with an open mind. Don't go in saying, "Oh, I'm gonna specialize in this," and try to like focus on that only, because then you just kind of miss out on a lot. But yeah, and pre-COVID time, Dr. Navazos would always get us like coffee, donuts, ice cream. So if you guys get into the normal dental school at USC, you'll have a lot of fun.
Okay, so Sona raised her hand. She could go next.
I'm a first year in undergrad, and I'm contemplating right now between going to either dental school or medical school. And I guess I wanted like a little advice on your guys' take. If I take both of like the exams, will like it have a negative effect on applications if I like go like to dentistry, if I choose to go to dentistry, or like when I'm contemplating between the two?
No, I took an MCAT, absolutely no effect. And I took a DAT, obviously. It has zero effect. If you personally want to know which route you should take, you're going to find that out through shadowing for sure. There's no other way unless you physically see it and experience it. Once you see it and experience it, you'll know what you like and what you dislike. And then from there, you can make your decision. But in terms of an exam, taking the MCAT or the DAT or both, it doesn't make a difference.
Yeah, you don't have to report the one score to the other. So I took the MCAT too. No one knows I took the MCAT from the dental school. It honestly depends on what kind of lifestyle you want. For me personally, I just didn't want the hustle of the hospital and the residency and graduating when I'm like 30. So I decided that dental school would be a better fit for me just because I shadowed both and I liked it. So if you can find like an oral surgeon like I did, who works at a hospital and who goes to clinic, and you can get to see both sides, or if you can shadow someone at the hospital and someone in a dental clinic, that's the only way you're actually going to know.
Specific to that after dental school, if anyone wants to message me, feel free, but I'll let you guys take the stage about ranking.
Since Berj fired that ranking comment, I'll just answer real quick. So ranking is how you rank per classmate. So there's 144 of us. If I get a 4.0, I'm ranked 1 out of 144. And that ranking is what specialty schools, whenever you apply for residency, they look at. So that's how they compare you to other applicants. So let's say I ranked 10 out of 144. That means I'm top 10 in my class. And if that's what a residency program is interested in and says, wow, this guy did really good or whatever, and he's up there top 10, he looks like a good applicant, then they pretty much accept you. So it's pretty much like how you compete with other classmates. That's what the ranking is. But I believe Berj has something else to add for sure.
No, I mean, you pretty much nailed it. The only difference is at USC, you don't have that ranking released, and they say they don't have a ranking in general. So all the resident programs, from what I know, all they get is your GPA, and GPA, like a 3.6 can be great at like UCLA, but it could be low at USC relative to your classmates or your class average. And since all they're getting is your GPA, how could they tell if that's like top 10 or bottom 10, you know? So it makes it difficult for most specialties to gauge where you stand relative to other applicants from other programs.
Okay, so out of respect for your time, we got 2 people raising their hands and we have 1 DM that was sent to me. So we're gonna ask the last 3 questions. So Talar, you could start, and then Tanvir, and then I'll ask the last question. Thank you.
2 quick questions. So I heard, I think it was Berge said that it's only the GPA that they get. My question is, I know UCLA, I just went to one of their like little forums recently, and they have a good amount of their class that like goes into specialty, and they're pass, no pass. So what do you like, if that's a little less indicative than a GPA, I feel like. So what do you think that is?
UCLA has honors, pass, and no pass, and
Oh,
they
that's right.
remediate until they pass. So the
That's
only people who get residencies are the ones who did honors.
Oh, okay, thank you.
So it's like the type, I forgot if it was the top 10 or 5%.
A lot of them do specialize though, yeah.
Yeah, a big amount.
Very big chunk. I think a lot of it has to do with their reputation too, and they're also a med-based curriculum. We don't have that. Ours is pretty much watered down for the sciences. So it's a more rigorous curriculum. It has that reputation, so it goes a little further if you're a UCLA grad when it comes to specialties.
Thank you. And then really, really quick question. I was just wondering if you guys know anybody to like talk to, or if you guys have like any mentors and stuff like throughout the application process. I messaged ASDA at USC, like saying, hey, can I have like a mentor or someone to talk to? Or like, I don't know, anyone from USC that we can ever reach out to. That would be helpful. Do you guys know anything?
I mean, I had a friend that was a second year when I was applying. She was also from UCLA, so I'd ask her. I don't know if we have an official mentor program, but you're more than welcome to like message and connect with us if you have any questions.
Thank you.
Well, we're planning on asking, sorry, my voice, Arik from admissions to also give a presentation. So hopefully we'll organize that soon too.
Yeah,
So
Arik's a solid guy, so I think he'd be willing to help you out, but
yeah,
don't quote me.
Yeah. So
Yeah.
Tanvi,
I had a quick question about like how competitive USC is. I know like some schools where like students are like they're really competitive, and if you ask for like notes or if any help, they don't want to help you or anything like that.
No, it's super chill. Like I make notes and I pass it out to my friends. Like no. There's probably some sneaky people in our class, but I highly doubt it. It's very collaborative, especially during lab time. Everyone's always helping each other out. If someone has a question, someone has the answer. And then it's extremely chill. I think it's probably the least competitive school when it comes to that aspect. So that's definitely a pro, which goes back to that USC pro con question. That's what I should have added. It's extremely collaborative. There's no like backstabbing. There's no hiding anything. There's none of that stuff happening. So you don't have to worry about that.
Okay, thank you.
okay, so last question. The question says, I'm also contemplating pursuing dentistry and realize shadowing is probably the best option to decide if dentistry is a path I can see myself in. But given COVID, it's been really difficult to find shadowing opportunities. I've tried reaching out to several dentists, but no success, unfortunately. So do you have any advice on how to get shadowing opportunities during this time?
Keep trying, because honestly, you got to cold call until someone accepts you. And if just shadowing is your only hindrance to applying, and you're dead set on dentistry, then you're going to have to shadow for sure. And they want shadowing, they require shadowing. I'm not sure if they're going to give you some leeway because of COVID, but there's going to be other people for sure on their application who have hundreds of shadowing hours. So you're going to need to do it for sure. Just keep calling and someone's going to say yes and you can go in.
Yeah, definitely keep trying. And I also I saw this on Instagram a couple of weeks ago, but There are some dentists that do virtual shadowing, so I don't exactly know how it works. I'm assuming they'll probably Zoom you and you'll just be there when they're doing a procedure, but that's also a thing. If I find something, I'll let Osnim know and then she'll disseminate it to you guys.
I think Osniv is frozen.
Yeah, I think we can wrap it up, Sophia, if you want.
Okay, thank you guys so much again for coming out. You guys did a great job. This was the first pre-dental event that we hosted with the Armenian Pre-Health Society. So thank you to you three. Thank you, Berj, for hopping in. And thank you to all of you guys for participating and for asking such great questions. We'll probably have the recording on YouTube maybe in like a week. So stay tuned for that. Anything else you guys want to say? Miriam, Armen, Talar, Berj?
Can we get added to the email list for like future events?
Yes, for sure. Osniv will send that over to our folks that are in charge of the listserv, and we'll make sure you guys stay updated with all that.
Okay, thank you.
And yeah, okay.
Thank you guys so much for coming.
You guys are welcome.
Thank you. Sorry, I got disconnected.
Thank you guys.
Thank you very much, guys.
Good luck, you guys.
Bye, thank you.
Bye. Okay, that was pretty good. I was very
That was all.
happy with
The
that.
last question, I get disconnected.
Yeah, no, you froze. So I was like,
Was
is
that-
she frozen? Is it my internet? But
Okay,
that
can you
was
stop
really great.
recording?
Oh yeah.